The man in bed 4 had been screaming for 11 minutes before Joanna even reached his door. She could hear him from the nurse's station, not the low, ragged moaning of someone in pain, but something harder than that, sharper, the kind of voice that had spent decades learning how to cut through noise and smoke and chaos and make other people move. She'd heard that voice before, not his specifically. But that voice, she knew it the way you know a thunderstorm before it arrives. Something in the pressure of the air changes. She paused outside room 1412 and took one breath. Just one. Then she pushed the door open. "Get that thing away from me." The aide, Tyler, barely 22, 3 weeks out of orientation, was holding a blood pressure cuff like it had personally offended the man in the bed. The patient was sitting upright despite the IV line running into his left forearm. Despite the bruising across his ribs that showed in dark green-yellow patches above the hospital gown. Despite the fact that his chart said he'd been airlifted here from a construction site, collapse, with 2 fractured ribs, a dislocated shoulder that had been manually reduced in the ER, and a wound on his right calf that was now showing early signs of infection. He was 58 years old. He had the kind of face that didn't look like it had ever been young. "Sir," Tyler started, "I said get it away from me. And get out of this room, both of you." Joanna stepped forward. "Tyler, I've got it. Can you check on Mr. Patterson in 408 for me?" Tyler didn't need to be told twice. He was out of the room before the door finished swinging. The patient turned his eyes to her. They were pale gray, the color of old concrete, and they didn't soften 1 degree. "You too," he said. "I'm afraid not." She set down the cuff on the tray table and reached for his chart instead, flipping it open like she was reading a grocery list. "I'm Joanna. I'll be your nurse for the next 8 hours. I didn't ask for your name. I know." She kept reading. "Colonel Harlan Briggs, retired. 6158. She glanced up. "The chart says 61. The chart is wrong." He said it the way people say things that have been wrong for a long time, and they've stopped caring enough to fight about it. She made a small note and kept going. "The wound on your right calf has been showing signs of infection since approximately 2 this morning. You were started on IV antibiotics at 4. However, the cultures came back an hour ago, and the attending has changed the order to vancomycin." She set down the chart. "If you don't receive the first dose in the next 15 minutes, we run a real risk of systemic spread. That's not a scare tactic. That's just how bacterial infection works." He looked at her like she was a wall. He was deciding whether or not to bother knocking down. "I've had worse than a leg infection," he said. "I don't doubt that. I've had worse than anything in this building. Okay." Something about her not arguing seemed to irritate him more than arguing would have. He shifted against the pillow, and she saw the flash of pain move across his face. Fast, disciplined, almost invisible if you weren't watching for it. She was watching for it. "I want a different nurse," he said. "The floor is short-staffed tonight. You've got me. Then I want no nurse at all. I want to sign whatever form says I'm refusing treatment, and I want everyone out of this room." Joanna pulled the chair from the corner of the room and sat down across from him. Not on the edge of his bed. She wasn't here to comfort him. Just in his eye line at the same level. She folded her hands in her lap. "You can absolutely do that," she said. "I'll get you the AMA paperwork. But I'd like you to hear me out for 2 minutes first, Colonel. After that, if you still want to sign, I will bring you the form myself." He studied her for a long moment. The machines beeped softly beside him. Somewhere down the hall, a cart rattled past. 2 minutes, he said. The infection in your calf is called methicillin-resistant Staphylococcus aureus. It's not responding to the first antibiotic we tried. The vancomycin is specific to it. Without that course of treatment, we're looking at potential sepsis within the next 12 to 18 hours. Sepsis at your age, with your current inflammatory markers. She paused. Not for effect. Just because facts deserve their own weight. It's survivable, maybe, but we'd be talking ICU. Potentially weeks. Potentially permanent damage to your kidneys. He didn't say anything. You were brought in for a construction accident, she continued. 2 fractured ribs, a shoulder that's going to need physical therapy. All of that is very manageable. What's not manageable is what's happening in that leg right now, and it only stops being manageable if we let it go. You done? One more thing. She leaned forward slightly. The 2 minutes aren't up yet, and I want you to get your money's worth. Something shifted in his expression. Not warmth, nothing like warmth, but the faintest recalibration, like a rifle scope adjusting. I'm not going to tell you what you've been through doesn't matter, she said. I'm not going to tell you hospitals aren't hard. I'm not going to pretend that lying in a bed with tubes in your arm while strangers move around you isn't, for a lot of people, one of the worst feelings they know. I'm just going to ask you to let me do my job tonight. Just tonight. And then tomorrow morning, when the next shift comes on, you can go back to being as difficult as you want. Silence. Then, you've got a mouth on you, so I've been told. He looked at the window. The blinds were half open, and the parking lot lights made a yellow smear across the wall. I'm not signing anything, he said finally. I'm not giving permission for anything except that one medication you're talking about. And I don't want anyone else in this room tonight. That's fair. She stood and picked up the blood pressure cuff. I do need vitals first. That's non-negotiable. He held out his arm without another word. By 11 o'clock, the floor had quieted down to the particular nighttime hush of a hospital, the low tones of monitors, the occasional soft footstep, a door opening and closing at the far end of the corridor. Joanna came back to check on the vancomycin drip and found Colonel Briggs awake, staring at the ceiling, his jaw set like he was in the middle of an argument no one else could hear. She checked the IV line, adjusted the drip rate slightly, noted his temperature, down a fraction. Good. You sleep? He asked. He wasn't looking at her. Not on shift. I mean at home. She glanced up. When I can. He made a sound that wasn't quite a laugh. I haven't slept more than 2 hours in a row since 2009. She didn't fill the silence with the usual things people filled it with. She just wrote down his temperature and moved to check the dressing on his calf. This going to hurt? He asked. Probably a little. Good. I don't trust things that don't. She worked carefully, peeling back the old dressing and examining the wound beneath. The redness had receded slightly. The vancomycin was doing its job. Construction, she said. Not a question, not exactly. Management consulting now. I was on site for an inspection when the scaffolding went. He paused. Bad bolt. Cheap contractor. Were you the one inspecting the contractor? A beat, yes. She didn't say anything to that. She cleaned the wound and began laying down a fresh dressing. 22 years, he said abruptly. She waited. Marines. 22 years. Made it through Fallujah, Ramadi, 2 tours in Helmand. Made it through all of it. And then I slip off scaffolding in Cincinnati because some 23-year-old cut corners on a half-inch fastener. Life has a sense of humor, Joanna said. That's one word for it. She smoothed down the last strip of tape. There. temperature's down a quarter degree since I checked 2 hours ago. The antibiotic's working." He said nothing, but she noticed his jaw had unclenched. She gathered her supplies and started toward the door. "Nurse!" She stopped. "The aide I yelled at earlier." He was looking at the ceiling again. "Tyler, yes, he did something wrong?" "No, he didn't do anything wrong." Then I was out of line. She considered that for a moment. "He'll be okay. That's not what I said." "I know." She paused with her hand on the doorframe. "I'll tell him you said so." "I didn't say that either." "No, but I'll tell him anyway." She glanced back. "Try to rest, Colonel. I'll be back at 2. At 1:47 in the morning, the night shift pulled her sideways. A patient in 416 had spiked a fever. 418 needed his catheter adjusted, and somewhere in between those two rooms, her charge nurse had flagged that 412 had pulled his call button twice in the last hour without leaving a message. She finished with 416 and went straight to Briggs. He was sitting up again. Worse than sitting up. He had one leg swung over the side of the bed and was holding the IV pole like a walking stick, clearly with the intention of standing. "Colonel, I need water. That's what the call button is for." "I don't use call buttons." She crossed the room in 3 steps and put her hand on his shoulder, not pushing, just presence. "You've got 2 cracked ribs, a shoulder that's going to slip again if you torque it wrong, and an infection we're in the middle of treating. You cannot walk to the sink by yourself. I've walked with worse, I don't doubt it, but right now, in this room, tonight, you can't." She reached past him and filled a cup from the pitcher on his tray table. She held it out to him. "Here." He took it, drank, set the cup down with more force than necessary. "My sergeant used to do this," he said. "Do what?" "Get in the way and act like he wasn't getting in the way." "Smart, Sergeant." Briggs made a sound low in his chest that might, in different lighting, have been a reluctant acknowledgement. He let her guide his leg back onto the bed. He let her adjust the pillow under his shoulder. He let her do all of it without making it easy, but also without fighting her, which, with him, she was starting to understand was as close to cooperation as it got. "You were a Marine," he said suddenly. She paused. "The way you move," he said. "The way you came into this room at 9 o'clock when I was making noise. You didn't hesitate. Didn't look around, just came in and started doing your job. That's not hospital training." "I'm good at my job," she said. "You are. That's not what I said." She tucked the blanket back around his feet. She was aware of the specific quality of his attention on her now. Not aggressive, but exact. The way someone looks at something when they've already made a decision but want to be sure. "Where?" he asked. "I should check on my other patients, Colonel. Where did you serve?" Joanna set down the extra pillow she'd been holding. She looked at him for a long moment. At the pale gray eyes, the jaw that had probably never relaxed all the way, the hands that even now, lying in a hospital bed, didn't quite look like they were resting. They looked like they were waiting. She reached up to the collar of her scrub top and slowly rolled back the left sleeve. The tattoo was on the inside of her upper arm, where most people wouldn't see it unless they were looking. A small thing, by tattoo standards, black ink, precise lines, just slightly faded at the edges from 15 years. The emblem of the 1st Battalion, 7th Marines. The same emblem that had been stenciled on the vehicles, the gear bags, the water bottles, the cheap plastic cups in the mess tent. The same emblem that had been on the patch above Colonel Briggs' left breast pocket in every official photo, taken between 2007 and 2010. She watched his face. She'd seen a lot of things in this profession. more in the years before it, and those years had not been quiet. But she had never seen a man of that particular type change the way Briggs changed in that moment. Not quickly, not dramatically. It happened in small increments, like something underground shifting, barely perceptible from the surface until suddenly the whole landscape looked different. He stared at the tattoo. Then he looked up at her face. Really looked, not the way he'd been looking at her all night, assessing threat level, measuring resistance. Something else now, something older. 1-7, he said. His voice had gone quiet. 2006 to 2011, she said. Camp Pendleton, then 2 tours in Helmand. I was a Fleet Marine Force corpsman. The word corpsman landed in the room like something physical. Your first tour, she said. 2007. Forward operating base near Sangin. He had gone very still. There was a corpsman attached to your unit, she said. Petty officer 2nd class. She was 23. The IED that hit the vehicle on that road outside the base. She was the one who got to your sergeant first, Sergeant Calloway. She paused. He didn't make it, but the 2 Marines with him did. The tourniquet she applied in the first 4 minutes was what kept Private Drucker's leg. The machines beeped. Down the hall, something shifted in the building's nighttime quiet. Briggs' throat moved. That corpsman, he said slowly. His voice had a grain to it now, like it was moving over rough ground. I tried to find her. After. I put in requests. Nobody could. The records were. He stopped. I know, Joanna said. I re-enlisted under a different name after I got married. Petty Officer Joanna Marsh is in the records. I'm Joanna Caldwell now. She let that settle. I wasn't hiding, it just got complicated. He looked at his hands. She watched him look at them. Those large, weathered hands that had probably signed hundreds of orders and shaken hundreds of hands and done things she didn't know about and things she could imagine and things nobody should have to imagine. Drucker still has that leg, she said quietly. He ran a half marathon last year. His wife posted it on Facebook. Someone sent it to me. Briggs closed his eyes, just for a moment. Just long enough that she gave him the moment without comment. I blamed myself, he said, voice very low, for Calloway. For that road, I authorized the route. There had been reports. I thought they were overstated. I thought. He stopped again. I've been thinking about it for 17 years. I know. You don't. No, she conceded. Not exactly. But I was there, Colonel. I know what that road looked like. I know what the dust smelled like, and how far the sound traveled, and what the light looked like at that time of day. I know what Calloway said when I got to him. She said it steadily, not gently exactly, but not without care. You didn't kill him, the IED killed him. There's a difference, and I know it doesn't feel like one, but it is. He didn't answer. You've been carrying it like it's a sentence, she said. I've watched men carry it that way. It gets heavier every year. It doesn't get lighter from carrying it that way. I know that. I know you know it. Knowing it and putting it down are different things. The room was very still. The drip of the vancomycin was nearly inaudible, but she was aware of it. The slow, steady progress of medicine doing what medicine does, trying to hold back what wants to spread. Sergeant Calloway's mother wrote me a letter, Briggs said suddenly. After, she thanked me. His voice cracked at the end of that sentence, almost imperceptibly, but she heard it. For bringing her son's body home, for the flag, for the ceremony, she thanked me. He shook his head slightly. I never answered it. She wasn't blaming you, Joanna said. I know. Then why didn't you answer? A long pause. Because I didn't deserve to. She looked at him for a long moment. 58 years old, and he had probably never said that out loud to another human being. You could tell by the way it came out, slightly startled, like it had been sitting in a sealed container for a very long time, and the lid had come off unexpectedly. "That's not for you to decide," she said, with respect. He looked at her. What happened out there was a command decision in an active war zone with incomplete intelligence and no good options, she said. "I was there. I know what the intelligence looked like. I was in the briefing room when you gave the order. You didn't flip a coin. You didn't take a shortcut. You did what people in your position have to do, which is make the best calls possible with what you have and live with whatever follows. Calloway didn't get to live with it. No. She didn't soften that. He didn't. That's true, and it's terrible, and it will never not be terrible. But you living the rest of your life in a closed room inside your own head doesn't balance anything. It doesn't give him anything. It just takes you out of commission permanently." Silence. "You were 23, he said suddenly. "When I got to Calloway." "Yes. You were 23 years old and you ran toward that vehicle. That was the job. That was more than the job." She looked at him steadily. "So was what you did. That's what I'm telling you." He pressed the back of his hand against his mouth for a moment, a contained gesture, a disciplined one. She watched him contain it. "I've had conversations with 2 therapists and a chaplain about what happened on that road," he said. "Not one of them said what you just said. I'm not a therapist or a chaplain." "No," he agreed. "You were there. Yes." The drip kept going. The monitors kept their soft, regular rhythm. "My daughter keeps asking me to come for Thanksgiving," he said after a while. "I haven't been in 4 years. His voice had changed, less gravel, something more worn. "I told her I had work commitments. She's 29. She doesn't believe me anymore. She's right not to." He made that sound again, the one that might have been a laugh in other circumstances. "You're still pretty direct for 2 in the morning. My approach doesn't change much with the hour." He looked at the window again. The parking lot outside was still, the lights making their yellow wash across the asphalt. "The scaffolding," he said. "What about it?" "I wasn't distracted. I want to be clear about that. I've been saying it was the bolt, and that's true. The bolt failed, but I've been tired lately. I haven't been sleeping. My mind goes places at 3 in the morning, and I get up, and I work, and I show up, and I do the job. But," he stopped, started again. "If I'd been sharper, I might have seen the issue earlier, before I was standing on the platform." He was telling her something that he had not told anyone else. She could tell by the way it came out. Not confessional, nothing dramatic, just flat and factual, the way people state things they've finally decided to stop not stating. "That's what 2 hours of sleep a night does to a person," she said. "I know. You're going to need to figure that out. I know that too. Knowing it isn't." "Enough," he finished. "Yeah, you said." She pulled the blanket up slightly. His temperature was staying down. She'd check again in 40 minutes, but the trend was good. The redness had pulled back from the margins of the wound. The worst of tonight, medically speaking, was already behind them. "The aide," Briggs said. "Tyler. I want to apologize to him in the morning. He'll appreciate that. I wasn't asking if he would appreciate it. I'm saying I'm going to do it. I know." She picked up her clipboard. "That's why I said he'd appreciate it, and not that's a good idea, Colonel." He looked at her. Something in his face that she couldn't quite name, not a smile, not exactly, but the architecture of it, the beginning of something that, with time and sleep and a Thanksgiving dinner 4 years overdue, might grow into one. "Caldwell," he said. "Sir, thank you 4 tonight. He looked like the words cost him something, but also like he'd decided the cost was worth paying. All of it. She nodded once. Get some sleep, Colonel. I'll be back at 4 to check the dressing. She was at the door when he spoke again. The letter, he said. From Calloway's mother. I still have it. She stopped. I've moved 7 times in 17 years and I've still got it. In a box, but I've got it. She turned just enough to see him. He was looking at his hands again. Then, maybe it's time to answer it, she said. He nodded once, a small, slow movement, like something that had been locked finding its mechanism again. She walked back out into the corridor. The floor was quiet. The monitors down the hall kept their steady, patient rhythm. She stood for a moment at the nurse's station, wrote up her notes on 412, checked the board, noted that 416's fever had broken. She thought about Sanguine. She rarely did anymore. Or rather, she thought about it in the way you think about weather from years ago. You know what it was like. You remember the color of it, but it doesn't soak you the way it once did. Tonight, she let herself think about it a little more specifically. The dust, the flat white sky, the way sound traveled differently there than anywhere else she'd ever been. The 10 minutes she spent on that road doing everything she could with what she had. The way Calloway had looked at her. Not scared, which she'd expected, but surprised, like it hadn't been real until it was real. She'd done what she could. She'd always believed that, even in the hardest part of the years after, when believing it hadn't come easy. Briggs had done what he could, too. He just hadn't believed it yet. Maybe now, she thought. Maybe close. The corridor hummed with the soft machinery of the hospital keeping people alive. She picked up the next chart. She had 6 more hours on shift, and 3 other patients who needed her, and she was good at this work. She had always been good at it, even before she understood why she'd chosen it. Even before she could have put into words what it meant to stand in the space between a person and the worst thing happening to them and says, I'm here. I'm not moving. Let me do my job. She was good at it. She went back to work.